So this is an important session on nutrition.
Madam,
That is nutrition for good health and nutrition for metabolic control. Metabolic control, by that we mean not only with reference to dysglycemia, with reference to diabetes, that is with reference to overweight, obesity, dyslipidemia, and other risk factors for atherosclerotic cardiovascular disease, namely Met syndrome. Yes. Over to you, Dr. Suresh. You can now start. What? Okay.
sir,
Now,
you start, sir, and we'll.
yes, we have two panel members, Dr. Dharani Krishnan and Dr. Paneerselvam. They're experts in this particular field. And with reference to nutrition, it remains a major cornerstone for maintaining good health as well as for patients with overweight, obesity. They need to bring down their body weight. And with reference to diabetes, they need to maintain good glycemic control. And with reference to dyslipidemia, we need to achieve optimal levels of the lipid levels. Right. So, madam, my first question is kindly convey to our participants regarding the normal nutrition plan, what you normally advise to your patients who are overweight, obesity, and diabetes.
Sir, the first thing to do is to take a very good food diary of what they are having, a survey of what they are eating. This is very important on a weekday and a weekend because it's very different in patients. Next is we need to know the family details of how much oil, how much vegetable they are using, which most people don't know today. If you ask them how much oil you are using, they say we buy a can, it's over, we'll buy another can. So they have no clue, so that's where the whole problem lies. So in obesity and diabetes, mainly because the lesser calories plus filling up your stomach with a lot of fiber and protein, which helps in satiety and also helps you not eat often, which means the snacking can come down. So both your lunch and dinner should be a 8-inch plate with, if you're diabetic, it should be red rice or black rice or hand pounded rice or millets, and with a cup of dal or sambar if you're vegetarian. If you're non-vegetarian, egg, fish and chicken are the preferred ones, and 2 cups of vegetable. This is where everybody goes wrong. They take a teaspoon of vegetable or half cup of vegetable, which is not enough. So proportions are very important. If people are not able to eat the full poriyal kootu like that, they can also add a salad. It's not wrong at all. They can have 1 cup of salad and 1 cup of cooked vegetable. If they follow this for 2 meals and maintain the oil to 3 teaspoons a day, automatically weight also will come down, sugar control also will come. But breakfast, idli and solita, they have 5 idlis, 4 dosas, this is too much. They should start with some nuts, or if they can have fruits, wait for half an hour, the right type of fruits like guava, papaya, and then have a breakfast. The number of idlis will go down. And those who can, in diabetic case, can move to idlis with unpolished rice or idlis with millets. And millets also, only tenai, foxtail millet and bajra are very good for diabetes. Thank you, sir.
Madam, I got a question. So, if you victimize one of the patients, not victimize, but I think if you label them that because you are a diabetic, you need to follow diet. Practical, then you got a house. Everybody has to cook for one person alone, they can't cook. இப்போ நீங்கள் சொன்ன மாதிரி ஐடியலாக if they want salad and everything, this breadwinner of the family, this guy or maybe wife, somebody is diabetes and they want to follow. என் ஒய்ஃப் எல்லாம் அதை பண்ணி கொடுக்க மாட்டாங்க. Can't, it's not practically possible. So how do you handle this question?
Very, very simple, sir. Just take a cucumber, tomato. So take a cucumber, tomato and a knife and cut it yourself and eat it, sir. Very simple. Then lunch and dinner ditto, sir. If it's
என்ன மேடம் சொன்னீங்க? Sir, I missed it. Sir, divert பண்ணுங்க.
Sir, you please take a knife, take a tomato, cucumber, cut it yourself and eat it.
Oh,
Nobody
the
has
house
to
owner
prepare.
has to do it. Okay, fine.
Yeah,
Whoever
whoever has-
diabetic is, But that is the challenge.
Prioritize, sir.
Okay.
That is the point. Once you prioritize your health, automatically you will change your ways, sir. Otherwise, it's very difficult because we have reasons every time to say, "The mudiyadu, mudiyadu, mudiyadu."
So,
Then
that is the overcoming this thing, because we all learn from this meeting or something and then go back home. Then you tell people and they can't follow for practical reasons. It is not that they don't want to do, but it's practical.
another simple method, sir. Rice vekkara edathile you can keep the millet on top, but you roast it and keep it. So no separate cooker. Right? These are very simple methods
Simple things
which can be. Yeah, correct.
Yes, Dr. Paneer. Yes, sir.
Sir, once you move from white rice to unpolished rice, a little more protein comes, and you're supposed to take milk 400 ml a day, either as milk or as curd. So in your tea, coffee, or in curd as it is, like that. So when you totally calculate, ICMR in 2020 has made it 0.6 gram per IBW, in ideal body weight. So if you are 60 kgs, you need only 36 grams of protein. And that will very easily come from a vegetarian diet. There's no problem at all. The problem is people are not taking the dal. So either take it as dal or sprouts or sambar or whatever you're making, that should be a necessity.
Yes,
All, madam, invariably all sambar are having dal, whether it is rural or urban or hotel, they add dal only.
இல்லை
the
சார்
thing
பட்
is-
டெய்லி சாம்பாரே பண்ணுறது இல்லை. அது வந்து they make lime rice,
Yeah.
they make puli rice, they make fried rice, they have biryani. Now the latest trend is
biryani,
get up at 3 a.m. and have biryani, sir. That's the most dangerous thing that's happening in Chennai today.
But even if it is a sambar, we won't be eating that amount
Quantity,
of sambar.
yeah.
It will be with the rice, less of kuli to less small drop there.
Correct.
yes, yes, Dr. Paneer. You,
Correct, but that is all will give you good fats, but protein little only will increase. You can have nuts. That's a better snack than eating fried stuff. She said dal, sambar, sprouts, if mushroom edukranga mushroom, paneer.
So week daily.
See, the main issue is 3/4 of the plate is rice, and then there's chips or vadam and they eat it. This is the problem. You need vegetable also, you need dal also, and if dal is not possible, like we said, sprouts, it's something you can make at home very easily and eat it. And it gives you quantity also, it fills you up also. But on the focus varno, sir, that is the problem. People are not focused on health. இது வந்து diabetes தானே 300 இருந்தா பரவாயில்ல, that's how they talk about sugars, which is dangerous.
But I think Sriram's point and Kumar's point basically is the protein. Whatever said and done, the quantity of protein what a human being needs, I don't think it's very, very challenging to get in every single day in our diet at least. Even though you say sambar and this thing, it is, as you rightly said, sometimes they just to volupify with all other things. But
The biggest challenge in India is non-vegetarians take less protein than vegetarians. Because in their homes there's no dal, the milk is very less. So their protein content on 5 days is very less compared to other days. So they should start including eggs, which should be easily available to them. That is one part. And there are some vegetarians who are moving to vegetarians. These are things which we can try.
yes, Dr. Paneer, you are a senior diabetologist. You must be keeping one dietitian in your center. So patient meets the dietitian, gets their counseling done, then subsequently they will come. Even if they have an initial discussion with the dietitian, they will want to clarify everything with you also.
double check.
Double
Double
check.
check, triple
How
check.
are you addressing? Please tell our participants how you normally address to your patient.
Of course, I do have through pharma people only, but I don't employ regularly.
But I have dietitian and health educator.
And especially young dietitians, they are, in general, they have been taught, but they do not know how to approach the patient and then how to approach in various level in the sense patient may be poor, patient may be rich, patient may be educated, illiterate, or socially active in so many meetings, etc. So all those things, being the youngsters, they are not in a position to keep it in their mind. So we have to approach the patient in such a way, whether they are poor or rich. So what do you mean by, as Madam pointed out, so complex carbohydrate diet, how much, and protein diet, how much, and fat, how much, and what do you mean by glycemic index, glycemic load, all those aspects, still many of our dietitians, young dietitians are not understanding. So sometimes some of the dietitians are saying, every day you can take one fruits. So they take mango, they take banana, they take jackfruits. So every day if they take one fruit, the glycemic index fruits definitely alter the glucose metabolism. So what do you mean by low glycemic index fruits? What is the role of fruits in diabetes management? Similarly for ghee also, ghee if they add, hypertriglycemia is not getting controlled if they go for ghee, vanaspati, dalda, even coconut chutney also alters the triglyceride level. So just finer aspects, some of the dietitians are not in a position to cover.
So I personally think, I mean, it's a fantastic job. The dietitian job is in which it is a multidisciplinary. They have to instruct people, for example, a renal diet or a gout or people with multiple pathology. So it is our responsibility that we sit with the dietitian and not well, it's not guiding. I think it's a teamwork. So we need to really phrase according to our patient population what we exactly want to translate to tell for a diabetic and obese or a polycystic ovaries in our endocrine clinics. And so it is very important that we focus on that rather than just saying that one fruit or whatever. So that is very important role that a clinician should play. As you rightly said, when they come and ask questions to us, then it is a teamwork that plays and wins. So that is our responsibility to become a group and just train according to what we need. That is
sometimes what is happening also, our colleagues, after dietitian being explained everything, they look at the number, they just write the prescription. So what they have been taught outside, they don't go through also. And they don't interact with the patient also. On what background the blood sugar is at higher level, whether the dose is being taken or not, or dose is being missed or not, or any sugar-rich diet is being taken in between, without interacting with the patient, because they have been educated well outside. They simply look at the number, they write some prescription. That attitude also we should change.
That's the teamwork comes into play. So it has to be a teamwork, and you really respect the team members and then translate into patient care. So that will be important.
Yes, madam, to you. Regarding the timing, number one, morning breakfast, then afternoon lunch, and night dinner, number one. Second thing is regarding the oil and the problem of coconut as chutney form, you just highlight.
Sure. So basically before 8 to 9 a.m. breakfast muchirno, sir. Then lunch should be between 1 and 1:30, and dinner should be between 7 to 8, preferably. If they are working very late, then they need a small snack, and it also depends on the medication of the patient and his weight and height. All this decides. But the most important problem is 11 a.m. and 6 p.m. This is when people tend to go completely wrong. They eat puffs, they eat biscuits. It may be a ragi biscuit, it may be a wheat biscuit, but everything has maida. Most of them also have sugar. So these are the problems where it spikes. That's why, as sir said, nuts makes a big difference. But can people afford? Even peanut is fine. You don't have to have almond and walnut. Everybody doesn't have to have almond and walnut. Yeah, even yellow, a small quantity of yellow is very good. It fills you up. So anything, it doesn't mean nuts and seeds can be even simple ones. You don't have to have the stylish ones. This is what we need to tell patients. And there are two things. One is sabja seed or chia seed. It is expensive, but you can bloat it, meaning you put it in 2 teaspoons and you put water. Within 10 minutes, it swells up. So if you bite that and eat, it actually fills you up. when it's only 2 teaspoons. Whereas other things you may need more things. But this kind of prioritization we have to tell the patient. And it's very important to do group counseling of the family. You need time. Because the whole family has to support whichever the patient is. It's very important. It's whichever spouse or whichever child or whatever it is. It's a family group team, as he said, doctor and dietitian. Yeah. It's a team effort. And when somebody is trying to get off the diet, everybody should come back and help. That is very, very important, sir. Otherwise, even like I tell in offices also today, or wherever you're working, parties need not be a cake or a sweet. It can be nuts, it can be dry fruits, it can be things like that. And if somebody diabetics there, it should be nuts only or fruits which they can take. This is very, very important to change in our culture.
Sundaram used to tell, wish them with vegetables. Wish them with vegetables.
Good one, sir. Yeah, oil. Okay. Yeah, sure.
Madam,
Thank
you can put the chair here.
Thank you, sir. See, oil, ICMR gives 20 to 25 ml. Dietitians give only 15 ml, only 3 teaspoons. The reason is, the food we buy, we are not counting. Like murku, tatte, whatever it is. Oil is coming in different forms, junk food, full of oil. So, we give only 3 teaspoons a day per person. In this, 2 teaspoons can be traditional oil. Gingerly oil for people who take it, or groundnut oil. The other 1 teaspoon can be rice bran or sunflower oil. The mix is because we need more of PUFA, being the cardiac capital of the world. So this is how we have to use. See, check in, how do you know the quality, sir? If you really know it's very good and you are, a stalwart in that, that's fine. But if they mix, how do we know? It may be 80% nallenna with 20% of something else, and then trouble starts, no? At least some government branding will give you some kind of authenticity, no? In the process oil kettadu abdin solradhu is one big, they've gone on to the other side. It need not be. They are just removing water, sir. Adla chemical podranga, idu pandranga. I really don't know whether they are doing it. Because if it's a branding, it should not be. Puridingla. Yeah, coconut less, sir. Not that you should not take it. It has the good, the bad and the ugly. When somebody is in ICU, we give them coconut oil because the MUFA is high. So, coconut, small quantities is fine. It's not 1 coconut for a family of 4 every day. It is 1 coconut, medium size, for a family for a week.
Paneer, உங்களுக்கு important question. டாக்டர், நான் மார்னிங் எல்லாரையும் ஸ்கூலுக்கு அனுப்புகிறேன். ஸ்கூலுக்கு அனுப்பிட்டு எங்கள் ஹஸ்பண்டை பேக் பண்ணி அனுப்பிட்டு தான் நான் சாப்பிட்றேன் டாக்டர். அதுலேயே எனக்கு கை நடுக்கும் படபடப்புலாம் வருது. பிகாஸ் இன்சுலின் நாங்கள் போட்டுட்ருக்கோம், டேப்லெட் போட்டுட்ருக்கோம். ஹவ் ஆர் யூ ஓவர் கம்மிங் சச் இஷ்யூஸ் வென் அ பேஷண்ட் கம்ஸ்?
அந்த மாதிரி ஆள் கம்மியாயிட்டு வரேன்.
Because madam, she tells it should be a teamwork. Husband மாத்திரம் ஹஸ்பண்ட் வராரு, ஒய்ஃப் மாத்திரம் வராங்க. 2 பேரும் வரதில்லை. இவர் எல்லா டெஸ்ட்டையும் பண்ணிவிடுவார். அவருக்கு ரெட்டினோபதி இருக்கும், யூரினரி ஆல்புமின் இருக்கும், எல்லாம் சொல்லி அனுப்புவோம். டாக்டர் நல்லா இருக்குன்னு சொல்லிட்டாருன்னு ஒரே ஒருத்தர் வச்சுருவார்.
Recent concept in Chennai, all flats are now coming out without kitchen. ஏடான்னு கேட்டால், சார் 2 பேரும் ஒர்க் பண்ணுறாங்க, 2 பேரும் குக் பண்ணுறதுல சண்டை போட்டுக்கிறாங்க, பிரச்சனை பண்ணுறாங்க. அதான் காமன் கிச்சன் வச்சுட்டோம் சார். ஃப்ளாட் நம்பரை சொல்லிட்டு சாப்பிட்டு போயிடுவாங்க. ரெண்டாவது ஃபோன் பண்ண ஆகுது, இல்லை அங்கேயே கிச்சன் கொடுத்துட்றாங்க. கிச்சன் கொடுத்து 24 hours கிச்சன் இஸ் ஃபங்க்ஷனிங். இப்போ உதயம் தியேட்டரில் அப்படி தான் வருது. வித்தவுட் கிச்சன் ஃப்ளாட்ஸ் ஆர் கம்மிங் அப். ஸோ அந்த பிரச்சனைக்கு ஒன்றும் இடம் இருக்காது. அஃப்கோர்ஸ் இந்த மாதிரி இருந்தாலும், அஃப்கோர்ஸ் சில்ட்ரன் அனுப்புகிறேன் போகிறேன் வரேன்னு சொன்னாலும், பட் they have to take food in time only. Somehow they have to balance both. கொஞ்சம் பேர் சொல்கிறாங்க தானே, இப்போ இல்லை ஐஎம் பிஸி. இப்போ நம்ம டாக்டர்ஸ் என்ன பண்ணுறாங்க, நான் ஆப்ரேஷன் தேட்டரில் தான் 8 மணி நேரம் ஆகுது, வளர்றதுக்கு வெளியே 7 மணி நேரம் ஆகுது. இன் பிட்வீன் ஐ எம் நாட் இன் பொசிஷன் டு டேக். நோ அதர் கோ, யூ ஹேவ் டு டேக். ஒரு லாங் ஆக்டிங் இன்சுலின் எடுத்துக்கிட்டு, இப்போ சப்போஸ் ஒரு ஆப்தால்மிக் சர்ஜன் டூரிங் 93 or 94 in Raipeta Hospital, he was completing his last case about 2:30 p.m. he is wound in the operation theatre with hypoglycemia. Because earlier we used to give him sulfonylurea plus metformin combination. That caused severe hypoglycemia. So we have to highlight to them and teach them timely food is essential. Of course, now we are restricting the use of sulfonylurea as well as insulin. The hypoglycemia rate is very much less after we add all these newer drugs along with metformin. But whatever the situation, whether they are poor, rich, working or not working, the timely meal is very important. As a physician or treating diabetologist, we have to highlight to the concerned individual.
Yes, madam. In the night time, during that is dinner time, most of the patients, they take around 10 o'clock, finish it off, and immediately they go for sleep. So there was an article published, I think few years before. If the patient takes early dinner, and if there is a gap of nearly 2.5 to 3 hours, that minimizes the risk for cardiovascular disease. What's your opinion?
100% sir. But sonna கேட்கணும்ல. This is
3
the
மணிக்கு
problem.
பிரியாணி சாப்பிடு.
அதான் அலாம் வச்சு 3 மணிக்கு போய் சாப்பிட. I really had a mini heart attack when I heard that day.
The queues are there in Chennai, 3 o'clock. இங்கே கொஞ்சம் பேருக்கு தெரியும் இங்கே இந்த குரூப்.
So this is the problem. You should eat before 8, sir. That is
Midnight biryani.
on one side we are talking about blue zones and the other side this is what is happening. So it's prioritizing, sir, and again teamwork. Everybody has to do it together, and you have to eat before 8 and you sleep by 10, good. But people sleep at 2 a.m. That is also wrong, no? Sleep has to be at the right time between 10 and 6 p.m., 10 p.m. to 6 a.m., sorry, and any 7 hours. So it's very important to do every aspect. Exercise, another thing people don't do.
Sir,
Yes.
my point is, I think, just 1 minute. The point is that when you sleep, it is not only the brain that gets rest. All the major organs should take rest. So if you are having food and everything, it will start digest. I also do that. I mean, sometimes you have to, but we should not be. But I think if you start putting things like a chicken and 1 kilo chicken vayithukulla potu 10 o'clock, if you want to sleep, body will be working hard just to get the digestion process going for 3-4 hours. Maybe when you are at rest, it may be more than that. So the body heat will be there, so your sleep will be completely screwed up. Even if you think you have slept, but the sleep will be in a big way waxing and waning, and you will not realize that your sleep quality hygiene is gone.
Sleep fragmentation.
It will be gone. Sorry. You.
Some people in the community, they take the food before the sunset and they take only after sunrise. Any just idea?
Yes, we are going to talk about intermittent fasting and time restricted. Yes, we are going to.
Yeah.
Illa,
See, before sunset-
restricted.
Correct. So basically they should eat right. When the vegetable and protein is there, it will digest slowly and release sugar slowly. They won't hit hypoglycemia. But if they just have rice, it is problem. Idli dosa is a shade better, but it should have a lot more of sambar to help, and there should be vegetable.
Next question is diabetic patient with established cardiovascular disease. Salt intake, caloric intake.
Yeah. See, basically, salt is if we start talking, it will take more than 1 hour. But I'll just tell you very briefly. ICMR says 5 grams of sodium, not salt. And what actually is happening is 15 grams is going in India today. That is why we are the cardiac capital of the world. One of the main reasons is BP, which is coming very young, is because salt. Now let's take the example of making soup at home from fresh vegetables. 200 ml soup will have only 2 milligram sodium. But if I take a soup packet and make soup, it becomes 10 times, 20 milligrams of sodium. So eating out, eating food from packets adds on to sodium. Today, chips is supposed to be a salty or sweet item. But it has sugar.
Salty and sweety.
But it has sugar. Your mixture is supposed to be a salty item. It has sugar. So salt and sugar are jumping the numbers very high today. That is one of the main reasons for obesity. So coming to cardiac disease and this, sodium has to be controlled. No salt on the table. Use less salt. Don't add salt to rice. Don't add salt to salads. Because your sambar has salt, your vegetable has salt, everything has salt. You don't have to keep on adding salt. The worst is, we were an agrarian country. That's why world over sodium is 2 or 3 grams. Only India was given 5. Today nobody sees the sun. But we eat like 3 generations ago, vattal, vadam, pickle, and none of that is made at home. That is even bought outside. So that is double trouble. So this is the reason we are in this phase.
So when you go for lunch, never add salt. So soup will be served today afternoon in the lunch. Please never add. Okay. So as pointed out, madam. Madam.
This afternoon.
Yes. Uruga, vadagam, battal, appalam, karvadu, please avoid. Right? Yes, madam. Yes, JSK.
One important thing that I like to also highlight is that tomato already has indigenous salt. So because most of the soup starts with tomato soup. So there is no point in adding an extra salt. So tomato itself probably has to be avoided for.
Many of us have a habit of adding salt in the soup.
Yes,
Before tasting.
yes, madam. Next is common renal diet. Renal diet in a patient with a diabetes.
Sure. Renal and diabetes are two opposites, sir. Whatever you can take for diabetes will not happen for renal if your potassium is high too. Because in diabetes we say take unpolished rice, take millets, all of them will be high in potassium also. So we have to watch out. The mistake people are doing is, because I am on a renal diet, no protein. This is wrong. Because your muscle will break down and create more creatinine. So you have to take at least 0.5, even 0.6 gram is good if you can take. But as sir says, nobody is taking 0.6. So we'll assess the diet that they're taking. And when they're adding supplements and all that, we'll cut that down. But definitely they need protein. There's no two ways about it. You need at least 10 grams of protein in 2 meals. This is very important, which they can get from dal. Today, lot of research is coming towards that vegetarian proteins are better than non-vegetarian proteins, even in a renal diet. I'm not talking about general, even in a renal diet. So I think we should slowly focus on that and bring. Soy is the only issue. It is high biological value, best protein in the vegetable kingdom, but it has a lot of anti-nutrients and hormone issues. So you have to be careful. You can't take it every day, whether man or woman. You can take it only once a week or once in 10 days.
Yes, regarding the fruits, what are the fruits that can increase the potassium level in a patient with established renal disease?
All fruits, all spices, sir. So you can have guava, papaya, pineapple if you are not diabetic. But otherwise, guava and papaya are the only 2 fruits you can take. And talking about potassium, turmeric is very high in potassium. So also coconut. So when you take all the spices, dhania, jeera, chilies, everything has potassium. So green chili is better than red chili because more water, less potassium. So you have to take less spices. That doesn't mean no spices. Jeera is better, which is cumin. All other spices reduce. That is very important.
Banana and citrus fruits also rich in potassium.
Correct. All fruits actually.
So the permissible
watermelon
one is
also are high. Sir.
Permissible is guava and papaya. That's all.
Highest is kiwi, I think, isn't it? Kiwi.
Kiwi potassium is.
Yes.
Kiwi, strawberry.
Yes, regarding the
Berries are better, but now it's coming. It's very expensive, sir. 600 rupees for 10, and within a day it is small. Plums also. Anything with skin will have higher potassium.
Ooty, lot of fruits comes from down only to Ooty for sale. True, sir. 80 to 90% of the fruits for Ooty comes from down. It doesn't. There is no the shops, whatever.
yes, madam. Another thing, how will we explain the process of cooking patient with a renal problem? That is, put the water, wash it well, then again put water on the vegetables, wash it well, and then you add water and like that.
Sir, if we add so much water, the actual leaching process, either you steep them for 1 hour in a lot of water, or you boil for 10 minutes and then throw out the water and use it. If for a potato, it's fine because it anyway doesn't have, I mean, the potassium will go away and it doesn't lose its taste. But think about a beans or an avarika. If you eat like that, you won't really like it. So ask them to eat watery vegetables which they are not used to, which are very low in potassium. Whether it's pushnika, soreka, podlanga, ridge gourd, bottle gourd, all of these. They are very good. They can start eating with that. They can leach maybe little bit of the beans and add. But again, depends on the potassium levels, whether they really need leaching. It's the non-veg also which adds to a lot of potassium. So if they cut that out and the spices, that itself will help rather than do too much of leaching. வேண்டவே வேண்டாம், கீரை குறைச்சிடலாம்.
பன்னீர் நார்மலாக பேஷண்ட் வருவாங்க, டாக்டர் ஈவினிங் டைமில் கொஞ்சம் பாடி வீக்காக இருக்கு, கொஞ்சம் என்னமாச்சும் எனக்கு ஒரு ட்ரிங்க் ஒன்று ப்ரிஸ்கிரைப் பண்ணீங்களேன், பாலில் கலக்கி தராப்புல.
ஏன்னா சாயங்காலம் ட்ரிங்க் ஆச்சு
சாயந்தரமா உள்ளது
இல்லை, அது சொல்லவே வேண்டாங்க மக்கள்.
எஸ் எஸ் பன்னீர், how will you answer?
Yes, they can check their blood sugar. Suppose they face low sugar, they can adjust the dose. And if they feel really weak with the normal blood sugar,
should we give importance to that and prescribing
not
and
necessarily.
Prescribing
Not
a
necessarily.
product
Not
which can
necessarily.
supplement?
Their own milk per se is milk, coffee, tea, that per se will help definitely. As madam already pointed out, whatever the protein diet they are already taking is sufficient. The commercial products are, because our population எப்படி woodwards grape water மாதிரி உங்களுக்கு ஹார்லிக்ஸ் 3-4 ஜென்ரேஷனாக சாப்பிட்டாச்சு. அதனால் they need some supplementary drink. If they ask for some supplementary drink, you can prescribe. Nowadays we have low glycemic index supplementary drinks, not necessarily for all patients.
Yes, madam, about certain food products, this can be promoted, company people varanga, that is low in glycemic index, high in fiber. What's your view?
See, first is affordability. It's a big challenge for most of the patients. It's like even, if they may at the beginning take a full scoop, then they'll start reducing. Then they won't get the protein or whatever. So if there's a person who can afford and they're not able to cook and things like that, we do advise. But otherwise, it's not mandatory that they have to take it.
Yes. Paneer.
The food wise, the most adulterated food available in India is paneer. That is evidence there.
No, paneer also should be made at home with toned milk. If you don't make it at home, it has lot of starch, and if they're making in high fat milk, you have no idea. You're asking for all the trouble in the world. And paneer is not a culture of South India at all. Why do we have to take it? We can take all other things and be happy.
Yes, madam. Paneer. Next is regarding now fasting இருக்கிற மேடம் அப்படின்னு சொல்கிறாங்க, intermittent fasting, time restricted fasting. What's your idea?
If the doctor, dietitian and patient are ready to work together, they can try. Yeah, otherwise it's dangerous because they can go into hypos, and there are two problems here. One is hypos, which is a very big problem. The second one is, if they do 16-hour fasting, they think they can eat anything and everything in the 8 hours, including half a kg of cake. This is dangerous. You have to actually intermittent fasting in the 8 hours, 2 meals only are allowed, which is you start with breakfast. You don't start at 12 noon. That's another mistake people make. You start with breakfast and you stop dinner according at 4 o'clock or 5 o'clock or 6 o'clock, according to when you start. Both meals should have protein and vegetable. The middle one is snack, which again has to have protein and a little bit of fruit or something like that. So that is the way to do it. People think that 8 hours they can eat everything. No, that's not it.
So there is a recent Mayo Clinic one, Francesca Lopez, I think this guy published something. It is he's a cardiologist, and the people who has got early cardiovascular death from the intermittent fasting, and this is very recent. I think he's so we should be careful about the signals that is coming out. As madam said, It's probably that they think in that 8 hours what they sacrificed in whole 12 hours. It's the brain. See, the brain will think, oh, I've sacrificed a lot and this thing just for my good sake. And then they go for the ramp at the 8 hours, they just go for the kill. So that is the problem. But we got evidence now that intermittent fasting is no good.
Paneer, உங்களுக்கு ஒரு question.
Another point. So during intermittent fasting, the glycemic variability and lipid variability also grossly changing. So that also causes endothelial damage, invites atherosclerosis, and increases the cardiovascular problem.
The religious fasting.
Religious fasting, they are suppose morning fasting one time. That is not going to happen.
So
This
we
is
have the
their-
guidelines.
Yeah.
We have the guidelines. We need to assess the fitness, whether this particular patient can undergo fasting during Ramadan like that. And if they satisfy the criteria, then we can advise whether the patient is on OAD, single OAD, double OAD, 3 OAD, depending upon the efficacy of the particular agent and depending upon the patient on insulin, like that we can modify. That is already.
Plan.
Whereas intermittent fasting, especially வெள்ளிக்கிழமை விரதம், சஷ்டி விரதம், கார்த்திகை விரதம்,
அமாவாசை விரதம், கார்த்திகை.
அமாவாசை விரதம். This is a main problem.
The biggest problem is feasting after fasting. That is what every religion, it's religion, no
See,
bar.
Viradam in non-diabetic is going to exhaust your store, then your store will get replenished. For that purpose only they have kept it already. That is different from your intermittent fasting.
This is like probably you telling your brain not to eat, and then when the opportunity comes in, you tell the brain, enjoy. So it is really, I think, the aspect, it's like having a Monjaro for 12 hours and then no Monjaro for 8 hours sort of thing, It is the brain control that is very important, and also hygiene of eating after the fasting, that matters a lot.
Yes, Dr. Balaji, he quoted one case, one particular community, they are taking morning meal around 10 o'clock or 9 o'clock, they finish it off around 6 o'clock in the evening, and nearly 12 hours or fasting, that they are normal individual, non-diabetic. Once they become diabetic, they should seek the help of doctor's advice whether this particular type of meal plan will be suitable for him to get rid of hypo and hyper. That we need to tell
That
clearly.
is very much possible nowadays. It's because earlier, while we were treating with metformin, sulfonylurea, or plus or minus insulin, we had the problem. Now, if you treat them with metformin alpha-glucosidase inhibitor, or metformin plus pioglitazone, or metformin plus DP4 inhibitor, they are all not going to stimulate the beta cell, release the insulin. So, if they take sulfonylurea, if they don't take food after 6 p.m., and of course by 11 a.m., they may be developing severe hypoglycemia. Along with the metformin, if they take DP4 inhibitor or alpha-glucosidase inhibitor, they may not. Even if the blood sugar fasting is not getting controlled, or post-dinner, 6 o'clock they are taking food, or 8 o'clock post-dinner is not under control, despite your non-sulfonylurea molecule, you can add small dose of insulin also. Analogs are not that much causing hypoglycemia when compared to previous insulin. So even if they are on 2 times of food, it is very much possible. Nowadays, monitoring system also easy now. They have self-monitoring, continuous glucose monitoring, when the blood sugar is going high, when the blood sugar is coming down, how to adjust the dose. These are all very much possible now. Just 20 years before, these are all unimaginable.
One other very important point is to educating doctors, because when the patient, sorry, this marine, there has to be plenty of it. So the educating doctor, why it is important is, a lot of people won't have an opportunity to have meeting a dietitian. What they will do is, in a village, if you go to near Annur or somewhere outskirts, they go to the doctor and they ask, okay, sir, எனக்கு என்ன சாப்பிடலாம்? He will give the knowledge, what he is telling, that will become gospel. That will be the probably that they will take it in the brain and just do it. You know what I'm saying? So, and then a doctor சொன்னாருன்ட்டு whatever this thing. So, it has to be an education to the healthcare providers, which is the key in changing our community. There is no second thought.
I fully endorse his view.
Even the periphery, the doctors, they don't have the sufficient manpower. They just have a staff nurse, they will run the thing, they
attender.
So that is the role of dietitian. So what advice the doctor is going to spend to the patient? Just 5 minutes he is going to see the patient. Out of 5 minutes, how much time he devotes to diet counselor?
This another problem in our doctor community is recently, for the past 5 or 10 years, our own colleagues in working in IMCU, ICU, post-operative ward, they keep the ward with 2 liters of Pepsi, 2 liters of Coca-Cola, half a kg of potato chips, samosa. They don't go for lunch, they don't go for breakfast. Whenever they feel hungry, they take the samosa or potato chips or burger or something, and they take soft drinks and spoil their health. Some of our colleagues are also facing heart attack by around the age of 30 or 35. They struggle with all non-communicable diseases. That mistakes we should not do, and as the senior people we should correct our youngsters.
அவன் வெளியே நின்று டோனட் சாப்பிட்ற மாதிரி.
Actually, yes sir.
Part of at least 4 hospitals in Chennai for the last 20 years. In the evening, in the 2 o'clock, 6 o'clock, in the hospital, correct me if I'm wrong. Madam, so in the healthy day to I'm not joking. All big corporate hospitals, but even less trust-based hospitals. You will get only some
Chat items.
So
For your
Boss,
information, in all our DPH
Very
meeting,
good.
they
Time
used
is
to give samosa earlier. Then after I persistently discouraged, they started giving sundal or vergalle.
but this has to be, yeah, industry. But it's very, very important. This happened in England almost 15 years ago. Jamie Oliver, you know very well, chef, what he's done, it is the biggest global initiative. So he went to schools, and in England the schools, they provide lunch. You know what they were providing? Fish and chips, all fried items and everything. So he saw, and then through government the whole country has changed through this thing. And Finland, it is a government that has taken initiative of banning all the fatty things and stuff. So it has to be in a mass volume, like what the government has done with mayonnaise 2 weeks ago. It's a fantastic thing. It has to, it's a time. So these kind of actions has to be taken. So 4 minutes more. So one more point is, we all had a good discussion, very good discussion about sodium, potassium, fat, protein and everything. So what is good for the patient, we advise. But whether that is good for the individual, the future technology is going. So it is the precision nutrition of an individual that makes the huge difference than saying, okay, you have this potassium less food of a maize or a mushroom. You can't just tell everything to everyone the same thing, even it may be low in potassium. So one idli, he's having one idli, I am having, his blood sugar will go to 140, my blood sugar will go to 160. The same idli. You can't tell one idli for everyone. So that is where the precision nutrition is going anywhere in the world. That is happening in poultry, and that is happening in human beings. So I think we should watch the space. It's purely technology driven, is going to be there for individual people.
Madam, one question regarding the shift workers. Shift workers, what advice would you like to give? Can I take around 2 o'clock in the night, this one, that one? What diet is allowed to be taken for a shift workers, especially diabetic patients?
No. See, what we do is, suppose they start work at 4 p.m. Sir. So at 4 p.m. when they get up, first have some drink, healthy protein, like it can be paneerselvam, it can be if they're not diabetic or diabetic. What are you talking about?
Both, for non-diabetic as well as for diabetic.
Okay. Then they have to have either thenai or something, some drink like that, and then not very thin. If they're diabetic, it should be spoonable, like your cereals that you eat. It should not be drinkable. Then they go for exercise and come back. Before going to work, they have to go exercise, come back, then have a proper meal, take their dinner and go. That's
Okay.
all.
Right.
Then during the night, the best thing to do is they can have lime juice with little salt. This is okay.
Good.
Nuts, 1 or 2. Hot water, very good.
Not 1 or 2.
Meaning, எப்பப்ப பசிக்குதோ, they have, இல்ல சார், meaning 1 or 2 types, meaning
Okay.
whatever you're taking, கொஞ்சமா, ஏன்னா அவங்க சாப்பிட்டுட்டே இருக்காங்க, அதான் problem. In BPO sector, when I did surveys, their HB level, hemoglobin level is very low, because protein illa, iron illa avanga diet la. So they have to be careful. And they should have proper meal before going, take their dinner. Between that 10 p.m. and when they come back, they should just have fluids. That's
Okay.
the best.
So allowed is lime water.
Suppose if they feel hungry, can't they go for any wheat bread or multigrain bread or tana kanji or some millet kanji?
Sir,
Fruits,
the thing
fruits.
is, all the breads are maida. There's nothing which is 100% wheat. If you really go out of the country, you can see that there are 100, wheat-based things. So we cannot get away. Even biscuits are like that. So maybe they can have a supplement if they want. That is the easiest. Mix in water and drink.
அது ஒரு சின்ன point, அது அப்சல்யூட் மார்க்கெட்டிங் கிமிக். 10 ஒரு 7-8 பிராண்ட் நான் என்னோட ஆர்த்தோபெடிக் ஃப்ரெண்டோட உட்காந்து சாப்பிடும்போது அவர் வந்து இந்த ப்ரௌன் பிரெட்ல சாண்ட்விச் வந்து சாப்பிட்டு ப்ரௌன் பிரெட் அந்த கவரோட எடுத்து வந்தது. அதை பார்த்த உடனே அப்புறம் அது அப்பதான் அந்த வாட்ஸ்அப் இன்ஸ்டாகிராம்ல எதுவும் வந்து வீடியோலாம் எதுலையுமே மேடம் சொல்ற மாதிரி 30% கூட வீட்டு கிடையாது. இன்ஃபேக்ட் அந்த மல்டி கிரெயின் பிஸ்கட் ஒன்று விற்கிறான் 5% கூட இல்லை.
ஏன்னா மேலே தூவாங்க அவ்வளோதான்.
மேலே தூவிட்டு ஜீரோ சுகர்னு சொல்லுவானுங்க பாரு இன்னொன்று. அமேசிங்லி ஜஸ்ட் மார்க்கெட்டிங். இல்லை அது அவன் வீட்டில் பொண்டாட்டிகிட்ட சொல்கிறதுக்கு ரொம்ப யூஸ்ஃபுல்லாக இருக்கும். டேய் தம்பி இதை பாரு ஜீரோ சுகர் நான் குடிக்கிறேன் அப்படிமா.
Yes, thank you. Yes, doctor, final question. Yes, 2 questions. Green tea.
Definitely நாட்டு சக்கரை, ஜாகரி, சக்கரை எல்லாம் சுகர் ஏற்றும். நாட்டு சக்கரை ஹேஸ் லிட்டில் மோர் அயர்ன் அண்ட் கால்சியம், பட் அது கம்மி ஸ்வீட்டாக இருக்குன்னு 2 ஸ்பூன் போடுறாங்க 1 ஸ்பூனுக்கு பதில். ஸோ டசன்ட் ஹெல்ப் இன் எனி வே. இஃப் யூ ஆர் டயபெட்டிக் ட்ரை நாட் டு டேக் திஸ்.
அந்த சிப்ஸு, அந்த கோக்கு, இந்த ஜீரோ சுகர் எல்லாம் அமெரிக்கன் மார்க்கெட்டிங். இந்த கரும்பு சக்கரை இதெல்லாம் வந்து இந்தியன் லோக்கல் மார்க்கெட்டிங். யூ அண்டர்ஸ்டாண்ட்? இதெல்லாம் வந்து நம்ம பயங்கரமான பழைய காலத்துக்கு போகிறேன், பழைய சட்டியில் வச்சு பண்ணுறேன். இதெல்லாம் மண் சட்டி, பானை, எல்லாமே மார்க்கெட்டிங். ஆனால் அதில் வந்து போய் குமிறானுங்க.
நான் டாக்டர் கருப்பட்டி இதுக்கெல்லாம் என்ன சொல்கிறதுன்னா, பேஷண்ட் மீட்டிங்கில் உங்களுக்கு சக்கரை போட்டு குடித்தா ஃபார் எக்ஸாம்பிள் 100 ஏறுதுன்னா, நாட்டு சக்கரை பணம் எல்லாம் கருப்பட்டி போட்டு குடித்தா 90 ஏறும். அது ரிஃபைன் சுக்ரோஸ், இது க்ரூட் சுக்ரோஸ். பத்துக்குச்சி பெட்ரோலில் வச்சாலும் பத்தும், டீசலில் வச்சாலும் பத்தும், கரைசலில் வச்சாலும் பத்தும். அதால் சொன்னா இழுத்துவா, நான் உதைக்கிறேன்றது. ஏன்னா the wrong information is keep on coming, including judges, IAS, IPS, everybody is listening. ஒரு ஐபிஎஸ் ஆஃபீஸர் நல்லா திட்டு வாங்கிட்டு போனார். பேசுகிறவன் யாருன்னு கண்டுபிடிச்சி பனிஷ்மெண்ட் கொடுக்க வேண்டிய போஸ்ட் ஒன்று. நீயும் யூடியூப்ல வருதுன்னு அவன் கான்ஸ்டபிளுக்கு ஒன்று என்ன வித்தியாசன்றது.
Kumar, you want to say one final.
அதுக்கப்புறம் பேஷண்ட் மட்டும் வரான்னு Absolutely.
So I think it takes a long process, and we have to, like Rahul said, we have to do it.
Correct.
So probably over a period of time, our community, my patient community will improve. If everybody of this hall trying to do it over a period of time, probably we can all. This is all collective responsibility.
பட் ஐ திங்க் இதெல்லாம் தம் அடிச்சுட்டே வந்து நோட் ஸ்மோக்குன்னு சொல்கிற மாதிரி தான். நம்ம எல்லாம் அதான் பண்ணுறாங்க. பட் ஐ திங்க் பர்சனலி ஐ ஃபீல் இட் ஹேஸ் டு ஸ்டார்ட் ஃப்ரம் சைல்ட்ஹுட், அண்ட் ஸ்கூல் இஸ் த பெஸ்ட் பிளேஸ் டு கோ. And childhood obesity, it starts from there. அங்கிருந்து ஹைஜீன் பழக்கணும், ஸ்லீப் ஹைஜீன், டயட் ஹைஜீன் has to start there, and that is the only way this country can go forward.
அதுக்கு தான் நாங்கள் ரெட் ரிப்பன் கிளப் இருக்கிற மாதிரி எய்ட்ஸுக்கு இப்போ ப்ளூ ரிங் கிளப் we are proposing to the government.
Yes. So
கிராண்ட் மதர் எல்லாம் ஸ்கூலுக்கு அனுப்புங்க மறுபடியும்.
So final message, வாழ நினைத்தால் வாழலாம், வழியா இல்லை பூமியில். இனிக்கிற வாழ்வே கசக்கும், கசக்கிற வாழ்வே இனிக்கும். So I thank all our panel members for sharing their experience to all our participants.